Hi, welcome everyone. The webinar is going to begin in just a moment. Hi everyone, and welcome to the inaugural webinar from the Epilepsy Research Institute on building a thriving research ecosystem. Today is, of course, Purple Day, the International Day for Epilepsy Awareness, and we could think of no better day to relaunch our webinars. My name is Sukhvir Bennett, and I'm Director of Research Operations at the Institute. And this is the first in our brand new webinar series called Institute Insights, where we'll be hearing from researchers working across the UK and internationally. During this series, we'll hear from people affected by epilepsy, from researchers working in the epilepsies and associated conditions, and we'll also hear about the work that the Institute has been doing. So before we begin the webinar, just a bit of context and background to this. You may remember that Epilepsy Research UK, as we were then known, funded and led the UK Epilepsy Priority Setting Partnership, which resulted in the top 10 priorities for research into epilepsy. And these priorities were decided by the epilepsy community. That included people affected by epilepsy and people working in epilepsy. And from the top 10 research priorities, 6 overarching broad research themes emerged, and you can see those on screen now. So firstly, we've got neurodevelopment, advanced therapeutics and disease modification, mortality, risk and morbidity, and reproduction and hormones. And these 4 themes are supported by 2 underpinning themes: capacity building and enabling technologies. And within each of the 6 themes on screen, we have convened leading researchers working across these themes to work together as theme leads. And today we're delighted to be joined by our capacity building theme leads, who will be providing an introduction to the theme and some of the exciting things they have been working on together, and most importantly, how you can get involved. But before we hear from our theme leads, I'm very proud to introduce Dr. Abbie Fearon, who is a member of our SHAPE network. And Abbie is now going to speak about her life with epilepsy. So Abbie, I'll hand over to you now.
Thank you very much, Sukhvir. And I'd just like to start by thanking you for having me on the panel. It's a real pleasure to be here today. So as Sukhvir said, yes, I am affected by epilepsy. I have epilepsy, and it was diagnosed relatively recently, actually. So it was in 2020, but I can now see that it started much earlier than this. So it was when I was about 13 that I started having really severe headaches and other symptoms that I now know were associated with epilepsy. For example, a strange smell that happens around the same time as these headaches or migraines. And it was my mum, actually, who at the time did a little bit of reading and thought that I might have epilepsy. And so took me to the GP where we were told that I was just having severe migraines and that there was nothing that could be done. So we went away, and these episodes continued a few times a year from then on. And then I had my first convulsive seizure in 2020, and it was then that I was first diagnosed with epilepsy. And it now seems clear that I was what I was experiencing for many years from the start of my teenage years was epilepsy, and I was having non-convulsive seizures. Luckily, my epilepsy is now under control, and I've been very responsive to medication. So I'm seizure-free, but not everybody is as lucky as I am. And that's why we need to do as much research as possible into epilepsy, so we understand the mechanisms behind epilepsy, and also to find new treatments to help people with the disease. I have an interest in epilepsy because I have it, but also because I have a background in research myself. So I have a PhD in tumour biology, and I worked in academia as a research scientist for many years, and have worked in cancer research more broadly for many years. And when I was diagnosed with epilepsy, I started doing some research around the subject and looking at what current research was happening, what was known about it, and realised that there was a lot of work that still needed to be done. And it was at this point that I thought I want to be involved in and contribute to epilepsy research, but at that point I wasn't quite sure the way in which to do that. And then I had a little look around of different ways that I could be involved, and I came across what was then Epilepsy Research UK. And I joined the SHAPE network. So I'd seen through my own research and work in the cancer research space how important patient and public involvement is in making sure that the right research is done and that the patient perspective is considered. So it was really great that I could be involved in that as a patient in epilepsy. And so from that, I've been involved in different funding panels, for example, and a few other bits and pieces like the priority setting partnership that Sukhvir mentioned early on. And I'm now also a trustee for the newly formed Epilepsy Research Institute. And the launch of the Institute is really exciting and important. There's much to be uncovered about the disease, and that can only happen through collaboration. And when I say collaboration, I mean between scientists and clinicians, but also between the funders themselves. Because we're all working towards the same goal, and everybody working together is only going to mean that we can find treatments more easily and faster. And a really important part of this is capacity building. I feel really strongly about this in research in general, and I think it's really important that we're focusing on that within the Institute now. And it's really great that we've got a theme with wonderful theme leads who can really try and build the capacity in this space. And the capacity building, I think, means encouraging the next generation of researchers into the field, but also keeping them there as well, which can be a real problem. So that's one element of capacity building, but the other, I think, is also helping to build momentum in the field by collaborating with researchers from different areas whose expertise can be utilised in epilepsy research. So, for example, thinking about the cancer research space, there are loads of researchers who are working on the basic biology of cell signaling that I'm sure would be applicable to epilepsy. There are techniques that would definitely be applicable. And there are, I was thinking about maybe like tumor biology, for example, and some of the effects of having brain tumors can be the same as having epilepsy. And so if all of these different disciplines are working together, then we can really advance the field much more quickly. And yeah, it's really great that the Institute has this as one of the goals. Yeah, I'm really looking forward to being part of all of what is to come and to seeing how we do in this space, because there's so much to be done and so many opportunities. So yes, thank you.
Thank you so much, Abbie. And of course, I introduced you as a member of our SHAPE network, but we are so proud to have you as a member of our board of trustees as well. And it's so brilliant to have your personal experience of epilepsy and your professional experience there too. And it was so brilliant hearing your unique perspective on this as well. And what you said about training and retaining researchers and having those collaborations across other conditions is so important. And that's something I think we'll definitely pick up in our panel discussion later. And so obviously you spoke about having your first convulsive seizure and being diagnosed with epilepsy during the pandemic. That must have been incredibly frightening in an already unprecedented situation.
Yeah, it was. And it was also right at the beginning of the pandemic, when we didn't know what was happening with the world. And also at the time I lived in Switzerland. I'm back in the UK now, but it was also very scary being in a different country, away from family. My husband was there with me, but yeah, I think it was also really scary for my family as well. They couldn't come over and visit and see what was happening. So yeah, it was a really uncertain time. And I think as well, when I had that first convulsive seizure, the doctors thought that I had epilepsy, but because it had only been one seizure, we thought that maybe it was a one-off. So I didn't go onto medication straight away. And I think I was also just really hoping that it wasn't that. And I thought, oh, no, it's fine. I'll just see what happens. And then I had another one not long afterwards. And that's when we realized that, I needed to try and do something to stop them. And the more I spoke to the neurologist, the more I realized exactly, what I said before about how I'd actually been experiencing all this stuff for years and years. And it all really made sense that it all fit in together. And yeah, I was just really lucky that I was with my husband when it happened, and somebody saw it and I could get to the hospital quickly. So yeah, and I've also been really lucky that it's been responsive to the medication, because I know that some people it's not the case, and that must be really awful.
Of course, of course. It must have kind of felt as though all the dots and the uncertainties were finally being connected that you'd had since you were 13 years old. And although obviously, getting the diagnosis was very daunting, did it kind of feel like, well, finally that all makes sense now?
Yes, it definitely did. And it was also, it was great in the sense that when I went onto medication, those episodes and those severe migraines that I'd been having, it's about 4 times a year I was having them, and they were really debilitating for a few days when I was having them, that all stopped as well. And that really made a difference to my life in general. So yeah, and when I told my mum that I'd been diagnosed, she was like, I knew all those years ago that there was something going on. So yeah, although it was really scary, as I say, I've just been really lucky that I've been able to control it.
Great. Thank you so much, Abbie. We'll be coming back to you shortly, but for now, I'm delighted to introduce our capacity building theme leads. We're delighted to be joined by Basic Science co-lead, Professor Torsten Baldeweg, Clinical co-lead, Dr. Sukhvir Wright, and Early Career co-lead, James Mitchell. So I'll hand over to you to introduce yourselves and begin the presentation.
Suki, you go first. You ladies first.
Oh, sorry. Thanks. Hello, hi. Thanks very much, and it's a pleasure to be here in the inaugural new seminar series. So my name is Sukhvir Wright. I'm the co-lead for capacity building, as Caoimhe said. I'm a paediatric neurologist at Birmingham Children's Hospital, but mostly I undertake some research into immune-mediated causes of epilepsy at Aston University.
Hi, my name is Torsten Baldeweg, and I'm a translational neuroscientist. I'm also the head of the Department of Developmental Neuroscience at the Great Ormond Street Institute of Child Health. And I'm particularly interested in epilepsy and epilepsy surgery in children and their overall development. And I look forward to discussing our plans with you shortly.
So, hi everyone, I'm James Mitchell. I'm a neurology trainee based at the Walton Centre in Liverpool, and I've just also completed a 3-year PhD fellowship funded by the Association of British Neurologists and the Guarantors of Brain charity. My research interests are in how we measure outcomes for people with epilepsy, and ensuring that the voice of people with epilepsy is really championed in deciding how clinical trials are performed. And I'm currently also the early career researcher co-lead for this theme. So thank you again for the opportunity today. So I think it's my go first to discuss what we really mean by capacity building and some of the work that we've undertaken within the leadership team over the past few months. And really central to this idea of capacity building, as we see it, is fostering this inclusive and supportive research environment, and it's contributing towards an inclusive and effective research culture. And in the next few minutes, I'll take you through some of the points on this slide and look at what we mean by some of these terms, looking forward to building capacity as part of the Institute. And first is this idea of building networks. And this is really learning from experience, I'd say. We know that collaborative research in the epilepsy community is most effective and most impactful. And we really see the role of the Epilepsy Research Institute as critical to bringing together researchers from different disciplines with different skills, as we've talked about already in this webinar. And it's really key to ensure that we can effectively answer many of those research questions that have been deemed to be priorities by the epilepsy community in the James Lind Alliance Top 10 partnership. So that's the importance of building research networks. I think key and one of our priorities over the next few years is to establish effective mentor and mentee relationships on the left-hand side of the screen. And this needs to be across all levels of research, right through from very early career researchers, so medical students, for example, undergraduate level, right through to establishing and facilitating kind of tailored networking and mentor relationships for very senior researchers. We think the other important factor is ensuring that we mentor people who may not have traditionally engaged with epilepsy research throughout their career. And this really is a priority. So that's ensuring we get allied health professionals, epilepsy specialist nurses, psychologists, clinical physiologists, for example, as well as research methodologists potentially working in other disease areas to move towards epilepsy. And having effective mentor-mentee relationships here is really important. If you look towards the bottom left of the screen, we have a few ideas here about how we're going to support researchers financially. And we already have a doctoral training centre funding scheme that's operational, and we already have early career research funding, but we really need to build on the work of the Historical Institute and build capacity over the coming years. And particularly at postdoctoral level, we feel that there's potentially some pinch points and that funding potentially tails off at the end of protected PhD time. And this is for clinical researchers as well as basic and translational scientists. So we need to work with the funders of research to ensure that we have dedicated grants relating to epilepsy. And this has been done in existing fellowships. So for example, there's recently been the ABN ERI, formerly ER UK fellowship that's been funded for clinical researchers. And we need to build on this work and ensure that we have some joint funded fellowships through other funders, for example, NIHR, Wellcome and the MRC Institute. The other pinch point is the fact that this funding will tail off at the end of PhD protected time. And we need a way in which we can protect these individuals and bridge those gaps between PhD level, postdoctoral level and lectureship level. And so that's something we're looking at in a bit more detail. And over on the right-hand side of the screen, we have this idea of multidisciplinary collaboration. And this links to what we were talking about a second ago about building networks. So we as an institute need to make sure we have the systems in place to facilitate multi-center collaborations so that we have the most skilled individuals, be that epilepsy experts, methodologists, or people with lived experience of living with epilepsy, working on the right projects. So we're working at the moment through the hub, which we're going to talk about in a little bit more detail in a few minutes, to build a database of current researchers and their skill sets. But we also are keen to undertake networking activities, bringing together people living with epilepsy, researchers and experts, perform roundtable discussions, and we're going to be performing a number of conferences over the next few years to facilitate building capacity. Some of these ideas could be very hands-on approaches, for example, in-person analysis of data sat around a table at the Institute headquarters. Other ideas involve bringing together people who are experts in epilepsy with lived experience to define some of the research questions more specifically. And this is particularly important as we enter this age of precision medicine and big data science. We need to bring together the most talented individuals from different geographical areas within and outside the UK to answer some of our key questions. So hopefully in the past couple of minutes, I've given you an overview of some of the ideas and some of our thought process behind building an effective research culture in the next 5 years as part of the ERI's plan. And of course, another key question that we need to look at in detail is what relevance does this have for research in epilepsy? And this slide is all about the amount of funding that is available presently in the UK for epilepsy research. And we know that 1 in 100 people in the UK live with epilepsy, and this is similar to other neurological disorders such as Parkinson's disease. However, as you can see here, there is much more funding currently allocated towards research in other disease areas than epilepsy. So this is an unbalanced equation. At present, we just have £21 per person being spent on epilepsy research in the UK, and this compares dramatically to £234 per person for Parkinson's disease and £97 per person for dementia. So there's certainly work we can do to leverage and use the expertise we have to negotiate and ascertain greater funding. So we've talked about some of the challenges with funding, and in the next couple of slides, Torsten will be outlining why now, and look towards a survey, which is going to be really exciting.
Thank you, James. Just to repeat what you've just said, if we put this into numbers, there are approximately 600 researchers in the UK working on epilepsy, which sounds a lot, but this is still only about 1/10 of the number of researchers currently working on dementia. And if you remember, the numbers are almost equal between the two conditions. Added to that, we have issues that face the wider research community, in the sense that there's a lack of funding for postdoctoral researchers to continue their academic career. And also there is there's a shortage of clinical academics who, beside their clinical training, manage to pursue an academic career that is important for any translational work into epilepsy. So how can you get involved? We specifically need your input at this time, and we would like you to contribute to a survey that we are starting, a survey of the wider research community, in order to establish a baseline of our current research capacity, and also to understand the facilitators and barriers in engaging with research into epilepsy. And this survey is aimed not only at researchers who are currently working on epilepsy, but also those who may have previously worked but have moved on to other fields, but also researchers who are currently not yet involved, but who we would like to be involved, as Abbie said, who come from different fields and can contribute vital expertise in terms of moving epilepsy research forward. So here is our survey, and we really need your input in order to establish our priorities for our work in the coming years. If you can scan in the QR code, it will take you straight to the survey website, or alternatively follow the link of epilepsyinstitute.org.uk capacity building. And we look forward to hearing from you. Thank you. And I'll hand you over now to Sukhvir Wright.
Thank you, Torsten, James and Abbie. You've certainly made my job a lot easier coming in at this point. But there's other things that we can definitely use through the Epilepsy Research Institute to build capacity. So, for example, the hub, which is exactly what it sounds like. It's the central part, the central core, a hive of activity. And it's the ERI's kind of online discussion portal for researchers that work in epilepsy and their associated conditions. And it's really becoming a place where the research community is coming together to discuss and develop the research programs and the themes that you've heard about, as well as finding opportunities for networking and funding opportunities and other useful resources. So access is to users who are affiliated with an academic institute or a hospital email. And as I said, it's divided into research themes, and you can see that from the picture on the slide. There are updates on there on those themes, live funding calls, really important like epilepsy statistics and reports, which can help you to form a real compelling argument when you're going for funding opportunities. Also job alerts, and patient and public involvement, which I'll talk a bit about again as well. And I think, again, this is a space where really we can build into that positive research culture that James was talking about earlier, with building networks, collaborations. And I think it fosters inclusivity as well, because not everyone is very confident about going up to people to talk to them. So perhaps giving this opportunity to kind of network online might be better for them. And, you know, it just means that everyone has a valid voice. You can post, you can talk to people, and it kind of makes it very equal, which I think is good as well for a positive research culture. I've certainly found it useful for dissemination of talks and seminars I've hosted, but also alerting members of my team who are moving on for job opportunities and the funding calls. And I've tried to make all my lab members sign up, and they found it very useful. So building capacity starts early, and eventually we want to go really early. So hopefully maybe attend some STEM community events and even catch, you know, young people before they even go on to university, etc. But at the moment, we're going to start with early career researchers. So these are people who are just starting off in epilepsy research, and we have an event coming up in May, which you can see advertised here. So in this event, we really hope to offer some hopefully inspirational talks from people in epilepsy research. We're hoping that they will give a kind of no holds barred account of how they got to where they are, some of the barriers that they faced and how they overcame them, and why did they stay and how did they stay in epilepsy research and get there and get to the point that they are at. I think every researcher has their own story. There's no specific path, and we can really learn by sharing each other's experiences. So as well as networking at the event, we also hope that we can offer one-to-one advice, perhaps again to help early career researchers to consolidate their career, so go on to mid and then long-term career researchers. So we will be there, hopefully. So this should be an exciting opportunity. So if you are an early career researcher and this sounds like something that would be useful to you, please do sign up without delay. And yes, the last slide, we're saving the best till last. And as Sukhvir described earlier in this week, the jewel in the crown of ERI, the SHAPE network. So as you can see here, it's the UK's largest group of research interested people affected by epilepsy, and a wonderfully enthusiastic and motivated group of people. As a researcher myself, who've interacted with the SHAPE network, I found them to be very friendly, very professional, and very insightful. I think in my SHAPE clinic discussing one of my grants, I think Abbie was actually in that panel, and she was super helpful in shaping that. So the people from the SHAPE network are really supported well through the ERI with training, and they contribute massively to the development of research ideas and supporting research and feeding back and informing research. Because PPI like this really should be the heart of any research, and epilepsy researchers need to, you know, capitalize on this resource that's just here waiting for them. And so I would very much encourage interaction. And again, you can do this through the hub. And I think this is really building momentum. And obviously it was people that were affected by epilepsy that took part in the priority setting partnership that have really driven this wave towards the Institute, towards all of these, the way the Institute is shaping up now through the priority setting partnership. And I just want to say, on behalf of all of us, again, a massive thank you to all the people who participated. It was a real privilege to be part of that PSP experience. And also it's a real privilege to continue to see now how that's developing and driving it forward. You obviously feel the weight of responsibility, knowing what needs to be delivered, but I think we're a great cooperative team that are working really well with all the other themes. So I hope that we can build capacity in response to all the fantastic work that's gone on to get to this point. But as Torsten and James both said, we really need that help. So please do take that survey today as well.
So thank you so much, Suki, Torsten, and James, for talking us through the work that you three have been doing as the capacity building theme leads. It's really exciting to see this. And I just wanted to pick up on the survey, which is launched today, which is really, really exciting. And I wonder what your message is to researchers watching this. Why should they get involved, and why should they take the survey?
I think it really is going to impact on their futures, really, because we want to build capacity in epilepsy research, but we really need some guidance on where to concentrate our efforts. So is it in the early career, mid-career? Is it in people, where are the pinch points that James has talked about? It'd be great to get some evidence behind how difficult those particular points are. So the more people that contribute, the more data we'll have, and then we can really concentrate our efforts on where it's needed to build capacity in epilepsy research.
Brilliant.
I think it's probably also very important to say at this stage that we're interested in views not just of those people that have undertaken lots of epilepsy research, but those that have maybe thought about epilepsy research, but they've had a perceived barrier or difficulty engaging historically. You're the people we really want to hear from to find out what we can do as an institute to help you engage. And this includes basic scientists, translational researchers, methodologists, but also allied health professionals that we're keen to hear from. So epilepsy specialist nurses, physiologists, and clinical psychologists, as well as people treating those living with epilepsy. So we're keen to hear all of your views.
That is also a unique opportunity as a scientist to work in a field that is extremely collaborative, where everybody works together with other specialists, with the patients and families, to make a real impact, and hopefully in a short enough time to really benefit as many as possible.
I just wanted to pick up on a point that James was talking about with allied health professionals. So Janine, who is co-lead for reproduction and hormones, was talking to me earlier this week about her nursing colleagues who want to get involved in research, but again, they just don't know how to take that first step. So I think each group of people who want to be interested or have interactions with epilepsy also just might need different types of help. So how to start an ethics application or how to present your research idea. So there may be all sorts of different ways that we can overcome barriers in different areas.
Brilliant. So if anyone watching wasn't convinced to take the survey, I think they certainly are now, that every incremental input could really shape the offering of the Institute for building capacity. So thank you so much for bringing this survey together. And so we've spoken about kind of the various ways capacity can be built and the ways that that epilepsy has been affected through inequalities in research funding. And so I wonder, are there other conditions that have built capacity and that we could learn from? Maybe Abbie, if I could ask that to you first, as you spoke about your work in cancer research. But I wonder if this is something that we could learn from other conditions for.
Yeah, I think cancer research is a really interesting example, actually, because there are so many people working in cancer research, and I think many different reasons, but maybe one is that there are quite a few places you can go to for funding and people know about it, and it's a very collaborative space, and there have been different types of initiatives from different charities and different funders to try and get people involved in research. My PhD was sponsored by Cancer Research UK, and that was an amazing opportunity for me to go and do my PhD and have that support from CR UK as well as I was going through my PhD. I think as well, there have been other initiatives that have been quite good. So when I left academia, I worked for the National Cancer Research Institute, the NCRI, for a few years. And the NCRI, sadly, is no longer with us. But one of the things that was great about that was the Early Career Researcher Forum. So it brought early career researchers together, and the early career researchers were involved and encouraged to be involved in all of the different projects from first thought all the way through to funding. So that was really beneficial, I think, for the field in general. And I think something on this that I think the Institute could be really helpful for is to be that hub. When people are looking for funding, they can go to the Institute and they can see what's available. Because I think sometimes that's it sounds silly, but it's actually a real issue. Sometimes people just don't know where to go for the money, and it doesn't necessarily have to be from an epilepsy research charity. There are other funders that can also fund the research, but people just don't know that it's there. So yeah, the Institute could really help keep people involved by signposting them to the fund opportunities that are available.
Brilliant. Thank you so much, Abbie. And I wonder, Suki, Torsten, or James, are you aware of other conditions that we could learn from?
I think the example that comes to mind is Dementia Research Institute. James touched on those statistics as well. And they've done amazing work to build their capacity and their institutes. And at the recent roundtable discussion that we had with the ERI and the DRI, it was really interesting to know that there are so many common themes in terms of the basic science. But I think it'd be really great to learn from them as well about, you know, their route to building such fantastic capacity with their institutes at different institutions throughout the country, and again retaining researchers in the field. So yeah, absolutely, I think they're a good example as well.
Yeah, that's a great example.
Mm-hmm.
And so James, I wanted to come to you. You're an early career researcher. What do you think kind of the challenges are facing early career researchers?
So I think if I look at myself as an example, I was relatively lucky early on in my career because I had very good mentorship, and that's really helped me learn the skills that I have, be able to apply for funding and be successful in attaining funding. But now I have this realization I'm at the end of my PhD time, and there really is a challenge in continuing your academic career. So this really is the pinch point that I'm in at the moment. There's less funding available, potentially at the end of someone's PhD, and you have this period where there may be a lapse in funding. Now, obviously, I'm very lucky. I'm a clinical academic, so I turn to my clinical job, and that's my day job at the moment. But finding opportunities at postdoctoral level and beyond certainly can be a challenge. So that's one of the things that we need to work on, I think, as an institutional level, to improve funding at the pinch points as well as mentorship.
And of course, Abbie, you were previously a researcher and an early career researcher. Does that resonate with you?
Yeah, I think the funding, I also wonder maybe with epilepsy, sometimes I think with early career researchers, you sometimes have to move institutes to go and do your postdoc, and that means move into a different part of the country or move into another country, and a lot of people just don't want to do that. So if you have more opportunities available for the it's happening across the UK, and there are more places where you can do the research, that would be really helpful. I think that sometimes that makes people not want to stay. And yeah, having the money there to be able to do it, because again, for a lot of early career researchers, it's the lack of stability in the funding as well. So you might get money for 3 years, but you have no idea whether you're going to have the money after that. And then people just don't like the instability either. So yeah, quite a few different things that need to be worked on.
Definitely. Thank you so much, Abbie. And then for Suki and Torsten, you're a bit more established in your career. I'm not going to say you're senior career researchers. That's not the term. But I wonder what support you've had during your research careers, and how has that helped?
Yes, I think mentorship is key, as James said, and I've had great mentorship throughout. I also think people need to have some guidance on planning for the next step. I think often, as James says, you get to the end, you think, oh, I've got to move on. But what I've had support from locally at my institution at Aston is the research office actually start planning with you almost like a year or 18 months in advance of when your funding runs out. And then they have a nice plan to tell you, maybe you should apply for this, you'll be eligible for this, let's try this. And then just that regular checking in, making sure that you're thinking of the next steps. I think for me, that's been really useful. And I think that's something that we could potentially offer as an institute. So as well as mentorship, just that kind of practical guidance on helping get to the next step, and also draw on experience in terms of being on interview panels, for some of the major researchers like Wellcome or MRC? What kind of questions do they ask you? So building on experience like that I think probably quite a few of the more senior epilepsy researchers have, and all of that I think is really useful information. Yeah.
Thank you, Suki. And Torsten?
Yes, so I would say I've been really lucky, and maybe others will seek similar situations out, to work in a place where everybody wants to work collaboratively. So I work at Great Ormond Street Hospital, where all the clinicians are very, very keen to advance treatment of some rare conditions or some very severe conditions, and do this very collaboratively with basic scientists, with physicists, imaging scientists, and so on. And this whole network where everybody brings their skill into the arena is really beneficial for individual development, and also setting yourself research goals and ambitions, and it's highly motivating. So I think, yeah, embed yourself in a wider real world network of clinicians and scientists, and I think you will enjoy this, and it will be very beneficial for your career.
Brilliant, excellent advice to share. And so we're close to the end of the webinar, although I think this discussion could go on for so much longer. Our final question to you all is, what are your hopes for future research into epilepsy? So James, how about you?
Yep. So for me, we know that epilepsy can be adequately treated, as Abbie was discussing earlier, in 2 out of 3 people, but it still leaves 1 out of 3 people living with epilepsy who are still experiencing seizures and the consequence of their seizures. We're at a time at the moment where we're developing precision medicines, and I think we should really leverage the work of the World Health Organization, the Intersectoral Global Action Plan on Epilepsy, which is an international action plan that's been adopted by all World Health Organization member states. And one of their key 5 objectives is to foster research and foster innovation. And so if we as an institute can leverage that agreement and work towards a more collaborative work environment, I think we will have some major successes in the next few years to come.
Brilliant. Thank you so much, James. Suki, how about you?
Yeah, I think I echo exactly what James has said, and I think the IGAP and the WHO initiatives have really put epilepsy and neurological disorders on the map in terms of improving outcomes. And I think my hope will be really also focusing on the comorbidities of epilepsy, particularly in children, and optimizing brain health. And I think this was in the top 10 for the priority setting partnership. So for me, I think that's the promise I'd like to deliver the most, or would like to see epilepsy research delivering the most, really optimizing and improving comorbidities and brain health in people with epilepsy.
Thank you, Suki. And Torsten?
Well, I think it has all been said really eloquently. I just wanted to add, obviously, I'm slightly more senior than most of you. And early in my career, I worked on one condition that caused a pandemic. And through really amazing collaborative effort throughout the world, it was eradicated more or less. And I would like to be in a position to maybe still in my career to be able to say something similar about epilepsy as a very complex condition, but we should aim to be able to treat it for the great majority, if not all, children and adults with this condition, and really to reduce all comorbidities as much as possible.
Thank you, Torsten. And finally, Abbie, what are your hopes for future research into epilepsy?
Yeah, I'd just like to echo, I think, what everybody else has already said. There's so many opportunities now that we can take to really understand the basic biology of epilepsy and use this to find new treatments that can help people live successfully and happy lives whilst also having epilepsy. So yeah, thank you, everybody who's doing all the research into it. It's really great.
Thank you so much, Abbie. Thank you. And that's a great note to to finish our webinar on. So thank you so much to Suki, Torsten, James, and of course Abbie for bringing your perspectives on building a thriving epilepsy research ecosystem. And thank you so much as well to James and Becca, who have been finessing the tech for today's webinar too. And just before we close, of course, today has been a very exciting day in that we have launched the capacity building survey. And so again, a final call, if you were a researcher and you're watching this, then please do take the time to take part in this really important survey to shape the work that the Epilepsy Research Institute is doing in this field. You can also stay up to date with any Epilepsy Research Institute news or anything that's happening in epilepsy research, either in the UK or internationally, and you can share discussion topics on the hub, as Suki said earlier, and you can join the hub by scanning the QR code on screen now. Of course, we also have our Emerging Leaders Symposium taking place on the 21st of May, and places are limited, so do email the conferences at email address on screen now if you'd like to attend. And finally, of course, if you're affected by epilepsy, then please do consider sharing your experiences and joining our SHAPE network to shape future research into epilepsy. So thank you so much again for joining us for today's webinar. We're going to be coming back to you with a number of webinars throughout the year, so do sign up to our newsletter to be among the first to know when the next webinar will be. So thanks so much everyone for joining us. Thanks to all of our speakers, and we look forward to seeing you again soon.